Okay, so I know not everybody learns this way, but this semester everyone, just took their first farm test and like the high score was an 80. Um, we're all in the trenches. So the way that I have found is super helpful for me learning pharmacology, and it might not be helpful for you, so you can ignore this if it doesn't apply to you, of course, is explaining it as if I'm a teacher, right? Like, I'll try and explain it to a layperson as if it's not, my fellow nursing school cohort member. I just sort of talk, right? Like, I just want to, like, explain it. So, we're talking about endocrine medications right now. And endocrine medications help control hormones in the body. Literally the other day, the teacher gave me the easiest softball question and said, "What are hormones?" And like I was tired and I blanked, and all I could say was, "They're like hormones." But obviously, they maintain homeostasis in the body. They're produced by different parts of the brain. If the body makes too much or not enough of a certain hormone, we're going to give a medication to fix it. So these medications typically help with blood sugar, thyroid problems, like levothyroxine, insulin, prednisone, growth problems, things like that. The most obvious one, maybe not obvious, maybe the most familiar one to most people is insulin, which helps bring blood sugar down. We give it to people with both type 1 and type 2 diabetes. Obviously, the nursing precautions for that depend on the type of insulin it is. I believe she said she's not going to quiz us on like all 8 types of insulin, but basically what you need to know is that you need to check your blood sugar before you give it. You need to see if there's a sliding scale, and watch for signs of hyper or hypoglycemia. And hypoglycemia is much, much, much easier to treat than hyperglycemia. When you get somebody in diabetic ketoacidosis, it is usually like a hospitalization emergency, whereas when someone is hypoglycemic, like I get hypoglycemic sometimes, I drink some juice and I'm chilling, And another type of endocrine medication, whereas like insulin is an intramuscular anti-diabetic medication, and that has to be injected. Metformin is swallowed. It's a type 3 diabetes pill. We went over this a million times, so you guys should know the 3 mechanisms of action. Basically, it stops the liver from making too much sugar. It helps the body use insulin better, and it slows down intestinal absorption of like glucose, sugar in the intestines. You don't want to give it before contrast dye. I'm not sure why, but that's a nursing consideration. Remember that. And nausea and diarrhea. Those are the things that you want to avoid. So moving on from diabetic medications, levothyroxine, we obviously went over a million times last semester. You should know that it is hormone replacement therapy for hypothyroidism. And this is for people whose thyroid levels are completely depleted or very, very, very low. And it is almost always, or I believe always, a lifelong treatment. It needs to be taken in the morning on an empty stomach. And signs, like adverse reactions, could be like fast heart, nervousness, weight loss, things that you would see with hyperthyroidism sometimes. Methimazole, so for a fast thyroid, it's basically if you have the opposite problem of a person who's taking levothyroxine, it slows down how much your hormone, your thyroid, is actually making. It may lower your white blood cell count, which I believe, don't quote me on this, but use your nursing judgment. I believe that would make you at least slightly immunocompromised, right? If you don't have enough or as many white blood cells as you did before. And then we're moving on to the adrenal drugs, so like steroid hormones. So that includes like your prednisone, which is used for like arthritis, swelling, asthma in really severe cases. It's a very strong anti-inflammatory, but you want to watch for hypertension for sure, because that can happen. Fludrocortisone helps keep the salt and water in the body, so it's like the opposite of a diuretic. It's used in Addison's disease typically. You need to monitor blood pressure. You need to watch for swelling and low potassium. You need to check those labs regularly. Pituitary medications. So desmopressin, wow, it's bright out, also helps the body hold on to water, so it's an antidiuretic. And it's used for diabetes insipidus, not sugar diabetes, which, you know, they've drilled into our heads a million times. We should know that. Strict isonos, typically with this medication, you want to watch for low levels of sodium. Somatotropin is a growth hormone for kids who aren't growing enough. You know, failure to thrive, that sort of thing. So you want to watch for joint pain in case they're like growing too damn fast, or high blood sugar can also occur. You want to monitor their height, make sure it's not, you know, doing too much. Okay, so that's pretty much it. So, just like, I'm going to get my face out of the goddamn sun, and then we're going to do like a quick review, right? And if this wasn't helpful to you at all, I'm sorry, but even saying this out loud was helpful to me. So, insulin lowers blood sugar. Obviously, most people know this. There's sliding scale insulin. There's insulin that's just, you know, given no matter what. There's long-acting insulin, rapid-acting insulin, regular, all kinds of shit, right? Metformin is the most commonly prescribed oral anti-diabetic drug. It helps with sugar in 3 different ways, which you should already know. Levothyroxine is thyroid hormone replacement therapy, basically, boost the thyroid. And methimazole does the exact opposite. It slows the thyroid, so it's for people with hyperthyroidism. Prednisone lowers inflammation. Fludrocortisone is a antihypertensive. Wow. I take that back. It is not an antihypertensive. It is an antidiuretic. Delete that. Extract. Take that back. It keeps salt and fluid in. Same thing as desmopressin. And somatotropin is the drug that will help children grow if they are deficient in growth hormone, which also falls under the endocrine medication category. Yeah, okay. Now that I've said that out loud, I feel like I really get this. We'll see what the next text looks like, but I don't know. I'm going to try this technique.